Is letrozole right for your fertility treatment? Imagine a medication that can help your ovaries release eggs more reliably, especially if you have conditions like polycystic ovary syndrome. That medication is called letrozole, and it is often used to help women ovulate when other methods haven't worked. It works by lowering estrogen levels temporarily, which signals the ovaries to produce and releases eggs. This process can increase your chances of ovulation and, ultimately, pregnancy. Many women and doctors prefer letrozole over another medication called clomiphene citrate or Clomid because studies show it tends to produce higher ovulation rates, especially in women with PCOS. It also has a lower chance of causing multiple pregnancies, like twins, which is a common concern with fertility drugs. For example, research indicates that up to 93% of women with PCOS ovulate when taking letrozole, compared to about 83% with Clomid. Additionally, the risk of twins is lower with letrozole, around 2 to 3%, versus 5 to 10% with Clomid. Another benefit is that letrozole tends to have less negative impact on the uterine lining, which is important for embryo implantation and pregnancy success. Most women tolerate letrozole well, experiencing mild side effects such as headaches, fatigue, hot flashes, or dizziness. Serious side effects like ovarian hyperstimulation syndrome are rare with this medication. Concerns about birth defects linked to letrozole have been largely addressed by larger, more recent studies, which show no increased risk of congenital abnormalities compared to natural conception or Clomid. Some data even suggest that birth defect rates might be lower with letrozole. However, letrozole is not suitable for everyone. It should never be used during pregnancy or while breastfeeding. Women with certain medical conditions or those taking other hormone-affecting medications need to be cautious and consult their healthcare provider. Because it lowers estrogen, it can interact with other drugs or supplements, so a thorough medical review is essential before starting treatment. While letrozole is widely used off-label for fertility, it is not officially approved by the Food and Drug Administration for this purpose. This means it should be prescribed and monitored carefully by a fertility specialist who can assess the risks and benefits based on your individual situation. When it comes to endometriosis, a condition where tissue similar to the lining of the uterus grows outside it, letrozole's estrogen-lowering effects might be helpful. Since endometriosis is estrogen-dependent, reducing estrogen levels could potentially help decrease symptoms or slow lesion growth. Some fertility specialists use letrozole in women with endometriosis-related infertility, but this approach requires careful medical supervision. The goal is to balance improving ovulation with managing the disease, which varies greatly from person to person. In summary, letrozole can be a very effective and safe option for inducing ovulation, especially for women with polycystic ovary syndrome or ovulatory problems. Its advantages include higher ovulation rates, fewer multiple pregnancies, and a good safety profile regarding birth defects. But because each person's health and fertility challenges are unique, it's important to work closely with a fertility specialist. They can determine if letrozole is the right choice for you, considering your medical history, other medications, and specific fertility goals. Always remember to seek personalized medical advice to make the best decision for your journey toward parenthood.